What are we looking at? We're still looking at planning, but we're looking at aim of care. Okay? Aim of care. So for aim of care, I tell candidates to picture in their heads, like, okay, my patient is experiencing pain or is at risk of a certain problem. What is my aim? So if my patient is in pain, my aim is I want to reduce that pain, or if possible, bring it to a 0 level. So your aim is what you look to achieve. Remember, your aim must be smart, okay? Or when you're doing all of this, it should be smart, meaning it should be achievable. Okay, and then we'll get to reevaluation date. I'll let us know certain things that are not achievable and why some people have failed planning just because it was not realistic and achievable. Okay, so aim of care is what you want to achieve. So if my patient was in pain, let's assume we're using Jones will verbalize relief of pain with a pain score of 0 to 3. Remember, during the nursing problem phase, when we were writing that, maybe we wrote John is experiencing pain related to fracture of neck or femur, evidenced by a pain score of 7. So our aim of care is going to be John will verbalize relief of pain with a pain score of 0 to 3 or 0 to 4. What this simply means is we would bring down his pain level. So it means the things we would do at the nursing intervention would help us achieve this aim of care. Do we get it? I'll give us another one. So for a patient who is at risk, let's assume it's a patient who is at risk of fall. Okay? The patient has not fallen, but is at risk. Now, at risk of fall, it could be maybe due to confusion or due to the fact that the patient is partially blind, or what else? Maybe the patient is using some assistive device and things like that. So, you would have written in the nursing problem, would have written Jones is at risk of fall related to confusion, evidenced by a GCS score of 14. Now, we're assuming if it was subdural hematoma, this is what we'll be able to write. Okay, because that a patient who is confused is at risk of fall because he has no idea at the time, a certain time, balance and things. So he's at risk of fall. So what do we want to achieve? Remember, it's a risk. It hasn't happened. So we don't want it to happen. So in our aim of care, we'd write, Jones will not experience any fall throughout his period of hospitalization or throughout his period of care, or whatever you want to put. So we're saying because it's a risk, we don't want it to happen. Another one for risk is risk of bleeding. If we had written risk of bleeding, when we come to aim of care, we'll write, Gemma will not experience any sign of bleeding or will not show any bleeding or any sign of bleeding throughout her period of care. So we're saying it's not going to happen at all. Now, I've seen candidates write, Gemma's risk of bleeding will reduce. Hey, come on. We can't write that. Okay? As long as it's a risk and it has not happened, we want to write it will not happen. Now, that is our goal. That is our aim. That is what we are working with. We don't want it to happen. Okay? Good. Another aim of care we would want to look at is, let's assume which of the aim of care, which of the nursing problem do we want to use? Let's assume shortness of breath. Remember in the sample when we were writing out the nursing problem, we said, let's assume we said Jones is breathless related to unstable asthma, evidenced by respiratory rate of 28 or whatever you get, as long as it's not within the normal range, because the normal range, come on, that's not breathlessness. Okay, so what we want to do, the aim of care we want to write for a case like that is John will show or will experience, remember there is a doing word, the verb, okay? John will show or will experience an improved breathing pattern, okay? So we're saying his breathing will be improved, okay? So John will show an improved breathing pattern with a respiratory rate of, most people write 16 to 20, some write 12 to 20. Why? Because from 12 to 20 is the normal range. I like to say we should always put it in a range, just to say that we never know where the patient is going to drop into in the numbers, okay? But what we're saying is, by the time we are done caring for this patient, giving them the necessary nursing care, holistic nursing care, this is what we want to achieve. One red flag or one thing I want us to note, if you didn't take anything out of this video, one thing you must take is, in the aim of care, you must be careful not to say the nursing problem or whatever it is will return to normal. Please, we have to be very careful. The words we want to use is the pain will improve, or no, the pain level there'll be a relief, or then if there was breathlessness, we can say the breathing pattern will improve. If there's urinary incontinence, we can say the urinary pattern will improve. You see the choice of words, improve or will be better. If it's something like pain, we could say they experience relief. If it's anxiety, we could say they will experience relief. But we can't say John will show no sign of anxiety, or John will verbalize normal anxiety level. Please, we can't put the word normal, please, especially because they give you a time frame to write your aim of care. Okay, so if you put normal, it can be really unrealistic. It was very painful when I saw a feedback of a candidate who wrote urinary pattern will return to normal, and she was asked to plan within a time frame of 24 hours. Now, the feedback was, it's not realistic. Okay, it's not realistic. So we want to make sure it's realistic. And what is that realistic is, whatever we're doing, we want to make sure that the patient will improve. Things will get better. Even if it doesn't go straight to normal or goes straight to ground zero, but there will be an improvement. I hope you have learned something new today. Before you go, just take your time. If you've not subscribed, please hit the subscribe button and hit the like button. All right. Thanks for watching. I'll see you